Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Have you ever wondered why sulfonylureas can sometimes lower blood sugar too well? Or why do patients often gain weight on them? In this video, let's walk through the story behind these two classic adverse effects, hypoglycemia and weight gain, and see how both come from the very same mechanism. Under normal physiology, insulin release is tightly controlled. When you eat and blood glucose rises, glucose enters the pancreatic beta cell. ATP levels increase. ATP closes the potassium channels. The cell depolarizes. Calcium flows in. And insulin is released. Notice the logic. More glucose leads to more insulin. And less glucose means less insulin. It's a beautifully regulated, glucose-dependent system. Now, enter sulfonylureas. Drugs like glipizide and glibenclamide bind directly to the SUR1 subunit of the ATP-sensitive potassium channel. And they close it. Not because ATP is high, nor because glucose is high, but simply because the drug is present. And that's the turning point. When the potassium channel is forced closed, the beta cell depolarizes. Calcium enters. Insulin is released. But here's the problem. This happens even if blood glucose is normal, or low, or falling. The pancreas is no longer responding to just glucose. It's responding to the drug. That's what we mean by glucose-independent insulin release. Now think about what insulin does. It pushes glucose into tissues. It suppresses hepatic glucose production. It prevents the liver from releasing stored glucose. So if insulin remains elevated when glucose levels are already low, blood sugar can drop further. Sometimes, dangerously so. That's hypoglycemia. This risk becomes especially relevant in elderly patients, in those who skip meals, or in patients with reduced renal function where drug clearance is impaired. Compare this to agents like metformin or semaglutide. Metformin doesn't stimulate insulin secretion at all. GLP-1 receptor agonists, like semaglutide, do enhance insulin release, but only when glucose levels are elevated. In other words, they preserve glucose dependence. Sulfonylureas do not. And that missing safety switch explains the hypoglycemia risk. The second effect, weight gain, comes from the same root cause. Insulin is not just a glucose-lowering hormone. It's anabolic. When insulin levels are elevated, the body shifts into storage mode. Insulin promotes lipogenesis. It drives triglyceride storage in adipose tissue. It suppresses lipolysis, meaning fat breakdown is reduced. So if sulfonylureas are chronically stimulating insulin secretion, the body exists in a relatively hyperinsulinemic state. And physiologically, hyperinsulinemia favors energy storage. Over time, this can translate into measurable weight gain. There's also a behavioral layer to this. If patients experience mild hypoglycemic symptoms, even subtle ones, they may eat more frequently or consume extra calories to prevent further episodes. That additional caloric intake compounds the anabolic effect. So again, we come back to the same mechanism: persistent insulin elevation. Let's simplify this. Sulfonylureas close potassium channels in pancreatic beta cells regardless of glucose level. That causes insulin release even when it isn't physiologically needed. From that single action, we get hypoglycemia because insulin remains high when glucose is low. Weight gain because insulin promotes fat storage. These are not random side effects. They are predictable pharmacodynamic consequences. Sulfonylureas remain effective, inexpensive, and widely used. They lower HbA1c robustly. They are orally administered. They are accessible in many healthcare systems. But modern diabetes management now weighs additional considerations: hypoglycemia risk, weight effects, and overall cardiometabolic profile. Understanding the mechanism helps us make better therapeutic decisions. It's not about labeling a drug as good or bad. It's about understanding what it does, and why. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.